Retiring before Medicare kicks in? What are you going to do about health care? What are you going to do? Actually, I get this question a lot because that's me. I'm in self-employed, and healthcare is a big deal for us, especially with the family of six. Braces, eyeglasses, never mind broken bones. By surgery I'm getting, I mean, it's nuts. So, actually, pretty good article from USA Today, and I got to say I'm pleasantly surprised because I do like to hammer the media because inflammatory nature of it. If it bleeds, it leads, and just the lies. I mean, no other way around that. But this is a good piece, so let's go into it for sure. This is from a lady from USA Today, and USA Today, nonetheless, is the founders of the clickbait movement, even though they'll never say that. But if you look historically, that's how they built. They built stories in, 4 or 5 paragraphs or basically an infantile to read. And that's what they did. I always liked it because they had great sports pages. I just don't read it anymore. I don't care. But back in the day, I used to love USA Today just for the sports pages. All right, so here's from Janet Herron, dateline June 4th, 2019. Do you plan to retire by 50? Great, but can you cover your health care is a question that a headline writer, certainly not Janet, has asked. So, you're ready to sock away half your income, earn more through side hustles, and aggressively invest so you can become financially independent and retire before the age of 50? But a big obstacle threatens to keep you from joining the FIRE movement, the high cost of health care and health insurance. Without a job, too young for Medicare, what health insurance options remain available for you? A handful, as it turns out. There are already tens of millions that provide their own health insurance, whether they're retired, freelancers, or independent contractors, says Leif Dahlin, who's author of a blog, Physician on Fire, and who's an anesthesiologist by trade. It's not any different. You just got to put it in your budget. And there's old Leaf right there with whatever that thing is. Is that a monkey? Leaf has researched many different options for health insurance before he fully retires from his job this summer. Right? Darlene is a member of the FIRE movement, Financial Independence Retire Early. He and other adherents laid out the following healthcare options if you're planning on retiring early. Private market. You don't need an employer to buy health coverage straight from insurer. Unless, what's her name? Who's the one saying they're going to get rid of all private health insurers? It was, what's her name? Kamala Harris, Bernie saying the same thing. I mean, these guys are going to get rid of private health insurance, which I don't know why that's not inherently a blow to freedom across the board, but that's what they're saying. They're not going to give you the option. Not going to give you the option. Remember when Obama said if you like your health care, you can keep, like your doc, you can keep it, and we'll have $2,500 reduction in premiums. As much as that was a lie, these guys aren't lying anymore. They're saying we are going to get rid of your private health insurance. Anyway, you don't need an employer to buy health coverage straight from insurer. In some cases, if you have a side gig that you incorporate, you may be able to write off some of the health insurance costs as a business expense. Says Sam Dogan, founder of the blog Financial Samurai, who's been financially independent since 2012. It's costly though. Dogan, 41, pays $1,760 a month or $21,000 a year out of pocket for a platinum premium for his family of 3. They could have saved $100 to $200 a month by opting for a bronze or silver plan, but the cost was still total more than $1,500 a month. It's an absurd amount of money, says Dogan. Either way you cut it, you're paying for unsubsidized health care is extremely expensive in America. I agree with that. Bare bones plans. New rules created under the Trump administration allows insurers to sell short-term policies up to 364 days. I looked into this a little bit when I went self-employed. I thought this was interesting, actually. What happens is, my understanding is once you get a pre-existing condition and you're in the beginning of that, that year, you won't get underwritten again for the following year. So that's always an issue, pre-existing condition. So, which is why I always like the public option of a pre-existing condition pool. If you got pre-existing conditions, you should have to pay more. That's all there is to it. I mean, it doesn't make any sense for our man up here, Financial Samurai guy, to pay $20,000 a year and essentially subsidize someone who's got pre-existing conditions, so that person can only pay $500 a month. That makes no sense at all. Should be the other way around, or some scenario like that. A pre-existing condition, I got no problem with a pool where you get subsidies for sure. I just don't think it does make sense. The healthy pay more than the sick. And that's not good. It should be the other way around. It sucks, but what else are you going to do? It's not fair to the healthy to pay more than what the sick people do. That's not good. So You get a pre-existing condition pool that's subsidized with taxpayers' dollars. I got no qualm with that. But then you leave out the people who don't want to be part of that to buy their own private coverage. So it's going to be a whole lot cheaper because pre-existing coverages will be taken care of by this pool. And we're all paying in by a taxpayer subsidy. So we're all kind of paying the same amount of money in the progressive tax nature that we have. It's just at the end of the day, the premium that our guy from Financial Samurai is paying will drop significantly, and the premium that the person on pre-existing conditions will pay will go up. Unless they need more subsidies, through government subsidies and whatnot. We certainly, that's what ACA, Affordable Care Act, is doing. I got no qualm with that in the least. But the idea of getting rid of A, private coverage, or B, making healthier people pay that much more than sick people is the wrong answer. All right. So anyway, the 364-day short-term policies, and there's a bunch out there, man. When I was looking up the Obamacare stuff, I came across these short-term policies, and there's a bunch. I was pleasantly surprised. I never went that route, but it was something to consider. They do exclude minimum benefits the ACA plans must provide, which is maternity. I mean, why would you? Excuse me, just yawn. Sorry about that. I'm drinking some hot tea, and for some reason, it's making me nice and relaxed. My Walmart brand peppermint tea. Relaxing. Anyway, so the short-term plans, they exclude minimum benefits that the ACA must make you provide, prescription drugs, maternity, and mental health care. Again, it should be a la carte, cafe style. You want this, you pay for it. You don't want that, you don't pay for it. That's simple. These plans, which often cover more catastrophic medical events, are cheaper but come with high deductibles. Man, that's the way insurance is supposed to be. Some early retirees rely on these plans for basic coverage and then use their own funds to pay for uncovered expenses like routine checkups. And the lady I interviewed on my podcast a while back, I have to look it up. Hold on just a second. I got to look it up because this is the stuff that they're doing now. Direct primary care, DPC, direct primary care, is freaking awesome. You pay essentially a subscription fee, $100, $150 a month, something like that. And then you got your PCP, primary care physician, right there at the ready for you. They don't take any insurance whatsoever, none. They're just taking out of pocket, $100, $150, whatever the prescription is. They're only taking a certain amount of people. It's fantastic. DPC, direct primary care. So you got your primary care physician covered. Now you got your catastrophic issues covered through this short-term stuff. Then anything else you need, you have to. In terms of big expenses, your short-term stuff will cover it. But if you need to get, we get tested for strep throat or something like that, you go to urgent care and you can't wait to get an appointment with your DPC provider. Well, you pay out of pocket, $200. That's the way it should be. Many of these companies are limiting. They don't cover any pre-existing conditions, like I said. So if you develop a chronic condition like diabetes, you won't qualify any longer. As I was telling you about a guy I was watching on YouTube who had a back injury, and he went through not Medicare, the other one, Liberty. They said anything that you need regarding your back, we're not touching, and that was interesting. So. And he was going on the fire movement. I think he's 50 years old and retired. And they said, we're not going to touch it. It's just not pre-existing condition. If you have a back injury, it's on you. And he just said, okay. Let's see. Old job benefits. I think this one's overlooked a lot. I don't know why. Jillian Johns Rood's family, her husband and 5 kids, receives health coverage from TRICARE, a healthcare program for uniformed service members, retirees, and their families. Her husband served 9 years in the Army before becoming injured and was forced to retire before serving the standard 20. Similarly, all others who work for the government may be able to get health care or benefits early in retirement. You still may have to pay some out-of-pocket costs. I mean, insurance is based on the idea that you're going to have some expenditures to use the insurance. I mean, that's what it's there for, man. You can't just use it like I'm going to the freaking doctor, like I'm chewing gum. It's got to have some kind of barrier to entry. It doesn't have to be a huge amount, but there should be a copay, a deductible, something. See, Johns Rood, who's 36, has a $450 annual deductible and must pay 20% for doctor's visits and other medical costs. They budget between $300 and $400 a month for uncovered medical and dental expenses. Nothing wrong with that. It's still our third largest expense, she says, author of Montana Money Adventures. Once my kids hit braces age, it'll be higher. Welcome to the club, man. When the couple pays off mortgages on their 2 rental properties, the extra money will go to future medical costs. That's the nature, scarcity. Healthcare sharing programs. I've talked about this a couple times on the channel. They're faith-based programs that facilitate voluntary sharing among members for eligible medical expenses. Members pay a monthly share similar to a premium, and then tap a pool of money when they need to cover other costs. The monthly share of these programs is often much more affordable than traditional health costs, and the coverage typically comes with lower out-of-pocket premium limits compared with high-deductible plans. Darlene is considering this route when he finally retires later this summer. He has a part-time schedule at a medical center in Minnesota, which also provides his family with health care. Okay, so he has a part-time schedule. I guess he's going to retire from that. I don't know. But if it's part-time, it still provides him health care. Why would he consider this? I don't get it. Because these programs have a religious affiliation, you may be required to be a certain church member or make a statement you believe in a higher power, says Darlene. Some are more specific than others. Some won't cover pre-existing conditions for the first few years, like I was just talking about. While others won't extend coverage to smokers. Some medical costs may be excluded, such as drug addiction treatment or pregnancy outside marriage, because they run afoul of the program's beliefs. Yeah. And you know that going in, by the way. They ask at least Medicare, they ask a pretty detailed examination of your belief that Jesus Christ is Lord and Savior. If you say no, you're not going to get covered. If you want to start an atheistic one, more power to you. I got no qualm with that. But you're going to ask explicitly if you are this type of person in that faith. And for Medicare is pretty profound, pretty Christian doctrinaire for sure. So if that offends you, well, that's not the place for you. The free market solution would be start your own, because it's a religious affiliation. Atheism is a religion, in my opinion. But who's going to discriminate? I mean, you can't discriminate pro or con religion. You can't. So I would certainly think you'd be well within your rights to start an affiliated group like that. And the fact that so many atheists got so much money, why not, man? I mean, the way I look at it, I mean, a lot of these portfolio managers and college professors with all these side gigs, they're freaking rolling in the cash. So that's the way it should be. If your income is low enough in your early retirement years, you may qualify for subsidies through the Affordable Care Act, the ACA subsidies. And this is what many FIRE aspirants do. For a family of 3, I need to make less than $400,000 of the federal poverty limit, or $83,000 to be eligible for health care subsidies under the ACA. The less you make in income, the more you qualify for a subsidy. Make too much, you won't qualify. There's also uncertain future surrounding the ACA given the political climate. If you're getting a subsidy, that's great, but I wouldn't count on that lasting forever. It's subject to change any time, and it should. To their credit, the Democrats in Congress and Obama, they did pass it via legislation, unlike the executive order that a lot of presidents are doing now more and more, which isn't good. A part-time job. I like this a lot too. Some early retirees choose to work part-time job to get insurance. For instance, John Zrood has a friend who's a bus attendant for the school system, working an hour and a half in the morning and again in the afternoon. They get full benefits, and if the bus isn't running, they aren't working, she says. And her friend gets plenty of time off, including summers and other school breaks off, but still maintains coverage. Another popular part-time job among FIRE achievers is working at Starbucks, which provides health insurance to part-time workers. It may not be the early retirement you're looking for. You lose some of the flexibility and are tied to the job benefits only. And then talk about medical tourism, and I think it's pretty interesting. Going to Mexico or the Philippines or something like that. Expats typically pay more for routine medical and dental procedures out of pocket in other countries where the healthcare is more affordable. Let's see. It all depends on what your current level of health and the level of risk are. This only works if you're traveling overseas for much of the year. You also need to be comfortable with seeking medical care in a foreign country. Keys to success. Research ahead of time. Darlene has spent months looking into the options and comparing coverage costs. As he was planning his early retirement, he asked his employer how much his coverage would cost each month to better understand the private market. Plan for higher costs down the road. If history is any indication, healthcare costs will outpace inflation. Calculate increases between 5 and 7% a year. I agree with that. Invest in your health. 100% agree with that. John Zrood tries to head off injuries and preventable diseases by working out 5 days a week and eating better. She also paid for a personal trainer and a nutritionist. That seems a little bit odd to me, to pay for a personal trainer and nutritionist to help them reduce the premiums for healthcare. Yeah, okay, but hey, to each his own, man. We're able to devote more time to meal prep now. We have more time to do more of the preventive care stuff. That just seems odd to me. One thing they don't talk about Cobra, and I don't get why they didn't talk much about Cobra. I mean, so for us, we were paying about $400 a month when I was at USAA. When I left, it was about $2,100 a month. Again, we have a family of six, and that was pretty good coverage for 18 months. So what I say to everybody, I say, look, just go get a job, even for a couple months as we get on their health insurance. Worst case scenario is you get off and get Cobra for 18 months. I mean, so let's just think about it. You're 62, you're leaving your crappy old job, all right? You got Cobra for the next 18 months. You'll be 63 and a half, all right? You find another job, you work there for 3 months, you stay there for a year, and you get, or stay there for 3 months, whatever, and then you get Cobra from them. I mean, the thing about Cobra is you're paying the full load of it. I think like a 2% premium on top of that. But you still have health insurance, and a lot of times, depending on what company you're doing, it's going to be a pretty good plan. So you're 62, you quit, you got Cobra for the next 18 months while you're setting stuff up, your blog posts, your YouTube channel, your real estate bit, whatever it is you're doing. 63 and a half, you run out of Cobra because Cobra only lasts for 18 months. You find some other crap little job for usually 90 days is when they let you on the health insurance, and then you just quit. I mean, it sucks, but guess what? The businesses don't care about you. You got to care about you. And then after that, you're on Cobra until Medicare kicks in, and you're golden, man. It's not a bad deal. I don't get why more people don't do that, because once you jump on the thing, you have access to Cobra. That simply means you're no longer getting subsidized like USA. They're paying roughly $1,600 a month for my health insurance, which is great. But going on Cobra, while expensive, it was horribly expensive while I was trying to build this business, but it's not the worst thing ever happened. It's not, especially if you got a gig that you think you have a pretty good chance to make some money, or especially if you are going kind of your part-time is working, start a bill. You're like, man, I just need to devote a full 2 years to this. Hell, hop off the train, get your Cobra, and you might find out that is more affordable than you thought with the money you could be bringing in, and budget for it, like the first guy was saying. I don't get the thing with hiring all these other people, personal trainer and a meal prep person or nutritionist, so I can reduce my health insurance premiums by $200 a month. I don't get that at all. But with that said, you can say, okay, I'm going to do this so I still maintain health insurance for the next 18 months while I'm building this business. After 18 months goes by, if I'm not making that much money yet, but it looks like it's still attainable, I'm going to jump on some other gig. Lowe's. You go to Lowe's, I think, 30 hours a week and get health insurance, all right? So I think you got to be 30 hours a week there or more, but you get something like that. But you get health insurance there. So you say, okay, I'll go Lowe's for 3 months, 6 months, something like that, be customer service. I'll smile and dial, do what they want me to do, knowing full well that after I do that and get on their health insurance, I'll jump off for 18 months. That'd be 3 years of you doing your side hustle thing, and if after 3 years, you probably have a pretty good idea if it's going to work. So, good article. I'll put a link to the show notes. As always, smash the like button, and we'll see you next time.